We begin with this dreaded confirmation from the health department. There are now 16 additional cases of the more contagious Delta COVID-19 variant, and 11 of the patients caught the virus locally. Our Rex Remitio joins us live. Rex, how serious is this situation we are in right now?
Authorities have been scrambling for months to stop the more deadly Delta variant from spreading in the country. But for the first time, locally acquired cases have been recorded despite stringent border controls authorities are implementing. That's why top government officials are now holding more meetings and visiting places where these local cases have been reported.
As authorities fear the deadlier Delta variant spread in communities, the Interagency Task Force is now placing Cagayan de Oro City under the enhanced community quarantine until end of the month, after 5 local Delta variant cases have been recorded there. ECQ is the toughest of the 4 lockdown levels. Nearby Gingoog City in Misamis Oriental is also under ECQ, as well as Iloilo Province and Iloilo City. The general community quarantine in Antique is extended as well, after reporting 2 local Delta variant cases. The other local cases are reported in Pampanga and Manila, where one of the patients died. All in all, 11 local cases recorded so far.
Hindi na po biro ito, and this is a special emphasis that we will be communicating to the local government units of concern in Region 6, Region 10, including Manila.
5 returning Filipinos were also found carrying the Delta variant. 3 of them history from United Arab Emirates, Qatar, and United Kingdom. The health department is still verifying the travel history of the 2 others. To date, there are 35 Delta variant cases in the country. The previous 19 recorded were all returning Filipinos who were immediately quarantined upon arrival. But since local cases are recorded for the first time, the DOH is now ordering LGUs to boost their systems in preventing, detecting, isolating, and treating COVID patients. Hospitals are also told to prepare for any potential surge in cases. The Transportation Department and Quarantine Bureau is also on high alert to prevent the Delta variant from entering our airports and seaports.
Mahalagang-mahalaga yung pag-strengthen ng border control dahil kinikilala naman natin na karamihan ng mga pumasok na variants ay nanggaling sa returning travelers.
The DOH, however, says there's still no local nor community transmission of the Delta variant. That's why they're calling these as local cases, since these were detected in different areas. Unlike a local transmission, where there are many cases reported in just one area, or community transmission, where authorities can no longer establish the links between many local cases.
It is sporadic in some of the areas. Meron tayong clustering doon po sa ibang mga rehiyon, pero ito po ay pinag-aaralan, ini-investigate pa natin kung may linkage ba sila sa isa't isa. At of course, gusto nating makita saan kaya nila potentially nakuha itong Delta variant na to.
The IATF says it will not hesitate to impose stricter lockdowns in more places where local Delta variant cases will be recorded in the near future.
Authorities are also saying the country is still far better off than India or Indonesia in terms of controlling the Delta variant from spreading locally. The health department says they will conduct more genomic sequencing of the samples and build more satellite facilities in Visayas and Mindanao. Back to you.
So Rex, how prepared is the government for the Delta variant?
Vaccine czar Carlito Galvez says the government, quote, prepared in scale for the variant. Galvez explains hospitals have been given more funds to add beds and buy treatment supplies. He also says more isolation facilities were added to accept more patients in case of a surge. They're also aiming to vaccinate more people with up to a total of 16 million doses by end of July. The health department says there's enough supply of oxygen tanks so far. Tia.
Rex, can you tell us more about the status of the patients who acquired the Delta variant locally?
DOH spokesperson Maria Rosario Vergere says close contacts of patients were already traced upon receiving the positive results. Health officials also told LGUs to backtrace to ensure accuracy of the count of local cases. So far, the DOH is just recommending localized instead of province-wide lockdowns and banning social and mass gatherings and other potential super spreader events. The Undersecretary maintains cases are sporadic and there's no surge yet in Delta variant cases. Back to you.
Rex Remitio there reporting.